Understanding postmenstrual bleeding.
Hello there. Today, we're going to discuss an important women's health topic, postmenstrual bleeding. This is a term that can sometimes be a source of confusion and worry. So let's clarify what it means, why it happens, and when you might need to consult a healthcare professional about it.
What is postmenstrual bleeding?
Postmenstrual bleeding refers to vaginal bleeding that occurs after a woman's regular menstrual period has ended. It is also often referred to as intermenstrual bleeding or spotting. A normal menstrual cycle is typically 21 to 35 days long for most women, and the menstrual bleeding phase, the period, usually lasts between 2 to 7 days. Any bleeding that happens outside of this regular period may be considered postmenstrual bleeding.
What causes postmenstrual bleeding?
There are several possible causes for postmenstrual bleeding. 1. Hormonal fluctuations. Changes in your hormones can sometimes lead to bleeding between periods. This can be due to changes in birth control methods, perimenopause, or other conditions affecting hormone balance. 2. Structural abnormalities. Conditions like uterine polyps, fibroids, or endometriosis can cause bleeding outside of the regular menstrual cycle. 3. Infections or diseases. Certain sexually transmitted infections, as well as other diseases like polycystic ovary syndrome, PCOS, can cause irregular bleeding. Remember, this list is not exhaustive, and many other causes can also lead to postmenstrual bleeding. Always consult a healthcare professional if you're experiencing unexpected or unexplained bleeding.
When should you be concerned about postmenstrual bleeding?
While occasional spotting can be a normal part of a woman's cycle, it's important to recognize when postmenstrual bleeding might be a sign of a larger health issue. You should seek medical attention if the bleeding is heavy or persists for several days, it's accompanied by pain, dizziness, or fatigue, you're postmenopausal, haven't had a period for over 12 months, it's happening regularly or frequently outside your normal menstrual cycle. In these cases, the bleeding could be a sign of an underlying health condition that requires treatment. In conclusion, postmenstrual bleeding or spotting is vaginal bleeding that occurs outside of a regular menstrual period. It can be caused by a range of factors, from hormonal changes to structural abnormalities or infections. It's important to be aware of your body and to seek medical attention if the bleeding is heavy, persistent, or associated with other concerning symptoms. Always remember, taking care of your health should be a priority, and there's no need to feel embarrassed about seeking help for such concerns. Until next time, take care and stay healthy.